Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel. And today we have with us two special guests that go by the name of Joey Testa and Travis Harvey. Now, I've been trying to think of what's the best way to introduce this to you all. And I couldn't figure one out, so I'm just going to share. Joey Testa is an influencer in the ortho space in medical device sales. Travis Harvey was a training pilot. And what I mean by that is Joey wanted to see if he took on a young man that wanted to make his way in the industry, what could happen? Could he get this person up to speed, and could this person be an asset to Joey's team? Long story short, it was an absolute win. Travis created an entirely new life for himself at the tender age of 19 years old. And Joey created an asset that is already making significant moves within the territory. So why am I so excited to share this story with you all? One, because this is the kind of story you want to hear, right? So many young people are finding out more about medical sales, and many of them are specifically interested in medical device sales, and they've heard of the ortho and the spine reps and what that life can look like. And for a young person to take advantage of this kind of opportunity, you really do got to be special in some regards, because it's not every 19 or 20-year-old that's that focused on wanting to create a career for themselves that they're going to make these kinds of decisions. That's number one. And then number two, it's great that everyone gets to hear this story, because now they can be inspired. Whether you're 19, 20, or 30, or 40, or 50, or heck, even 60, learning how someone can get into this world in a really unorthodox way is the name of the game. I believe in that wholeheartedly, right? We literally have a program that helps people that don't have the automatic medical sales ready qualifications, but we're able to work with them and help them get into medical sales positions. This program is a joint program with me, Joey, and Travis. And when I say me, I speak for our organization, Evolve Your Success. So with the Evolve Your Success team, Joey and Travis, we have created an ortho program for professionals, you listening, that want to be in orthopedic device sales. Again, this program is specifically orthopedic device sales. And in this program, it's not so much about just getting the job. That's included, but it's more going to be about how you can be the most amazing ortho sales rep your first year. One thing that is not talked about enough, and I'm actually going to have some guests on here in the next few months in 2024, is that there's a lot of people that get into this space and then they quit 5 or 6 months in, and it's double-sided, right? There's the candidate issue, which is someone who doesn't really know what they want. They've heard about medical sales. They've somehow gotten someone to give them a chance, and then they realize they absolutely don't want it, and they quit. That's one of the reasons why our program, we specialize in helping you find the right fit as opposed to just throwing you into something. On the other side of the coin, though, you have these companies, younger companies, the ones that do this, or I see more guilty of doing this, and they throw these completely unprepared people into the field and expect them to move mountains. And then when they don't in a quarter, they cut them. So this is an issue. And when we see this going on, we think, okay, how can we get in front of this issue? And of course, it leads to the birth of a program like this, something that allows you to really give yourself the best chance of not only getting the job in a medical device ortho role, but doing really well, and of course continue to do so. So in this program, you are actually going to be able to work alongside Joey and Travis, meeting surgeons, learning how to do procedures, and of course, more importantly, getting the job and learning how to sell effectively so that you're strong your first year. But I'm not going to sit here and continue talking about it. I'm actually happy to share that on this episode, you're going to listen to Travis's story, how Joey met Travis, and of course, the program that we're all doing together. Super excited to bring it to you. This is what, one thing I like to say is this is the kind of stuff that dreams are made of, right? For all of us to be in a position to create something that we know is going to truly change lives with people that want to be specifically in ortho device sales. So without further ado, as always, we bring you guests who are doing things differently in the medical sales space. And I'm happy to share this interview with you all. As always, thank you for listening to this medical sales podcast, and I really hope you enjoy this interview. Hey, gentlemen, how are we doing today?
Hey, Samuel, how are you?
Hey. I'm fantastic. Glad you guys can make it. I'm sitting here with, you know what, let me let you guys do the honors. Why don't you tell everybody who you are and what you guys do?
All right. Yeah, my name is Travis Harvey. I'm a clinical specialist with OrthoGrid Systems Incorporated.
My name is Joey Testa. I'm the VP of Sales for the East for OrthoGrid as well. And we're here on your podcast, man.
I love it. Okay, we're going to get into everything, guys, but let's get everybody some context real quick. So what is OrthoGrid? And you guys are in orthopedics, but what specifically do you sell?
So OrthoGrid is simply the first and only AI technology approved in the world for orthopedics, for total hip application and for trauma. And we've had it, it's been a progression of what it's actually been. It's gone through several stages. But this year, we've been really excited to have OrthoGrid launched our AI technology, both for hip and for trauma platform. So it actually won last year at AAOS in 2023. It was the John Charnley Award winner for total hip. They only choose one company in the world, and OrthoGrid was selected as that, and so we're really proud of that.
Wait, so say it again. The only AI what? Say it one more time.
No, it's currently the only and first of its kind AI technology approved artificial intelligence in orthopedics to be sold. And what it does is it tells you your reversion and inclination on your cup, and then it also gives you your leg length and offset for doing a total hip. And then for the trauma application, we have the ability to utilize it in any surgery that you can do in trauma. So it's pretty intuitive. It's fully automated. So instead of having to use a human, its algorithm is composed that we just take an x-ray, and it's built off of an x-ray platform. And it comes up on this 4K screen that's very large, and it's the size of bigger than Travis's head, but I don't know if you can see it, but it's just the monitor is brought into the OR. So
okay, so you said reversion, you said inclusion, you said cup. Now Travis knows what that means. You know what that means. I know a little bit of what that means, but there's a whole world of people that are listening right now that have no idea what you're talking about. So without giving us a full-blown orthopedics anatomy and operations lesson, why don't you just give us a little insight and context into why this is so valuable and why this AI technology is so game-changing?
Yeah, so in 2023, we should be doing things more like this, but in 2023, we're doing this. We're eyeballing it, and that shouldn't be the standard. So we, in a simple sense, we give quantitative numbers to surgeons to make decisions.
So what he's referring to is when we're doing this, it sounds funny, but when you do a total hip, there's a couple different ways and you can measure your leg length and offset, right? So imagine, Samuel, for the people that are out there that aren't in orthopedics, right? We want to speak to them too. There's a rep in the OR and usually some source of technology in the OR currently in 2023, as you can imagine, whether that be robotics, whether that be AI, whether that be as simple as like, oh yeah, it looks good. It sounds funny, but the majority of cases done currently on surgeries for patients right now for total hip, we don't have a really good technology built around that makes it easy and cost efficient for us to go in and say, hey, this is your perfect leg length, or these are the leg lengths that we're shooting for. So when he says quantitative numbers, it actually gives you the exact down to the millimeter science as to how long your leg is compared to your contralateral leg, which is your other leg.
Wow.
And then we can actually do an overlay too that will match up to show, hey, this is what we planned. This is where we're at. You can confidently leave the OR knowing that your leg lengths are ideally where you want them. So what he's saying with this is currently we hold up, it's as funny as holding up sometimes a piece of paper. Sure. So we have all this stuff and technology in the world, and people, tout robotics, but it's really hard to get that answer. So this is the first piece of technology that just taking with one simple x-ray, you're able to get your cup version, which is what we were talking about before. So we could show that later maybe, but your cup version, as long as your inclination. So we're shooting for usually around 40 to 20 degrees. So 40 degrees of inclination and 20 degrees of inversion.
That is awesome. So I'm assuming that the ramifications of not having this technology are the possibility that patients aren't getting the best care because they're not getting that accuracy in leg lengths and things like that, or not? Is that not?
We're guessing, right? So instead of guessing, now we have the ability, but with full automation. So there's other technologies in the world that comparatively do the same type of thing, but it doesn't do it as fast. And it doesn't do it fully automated. So when you take that x-ray, you get the immediate response quantitatively that shows both the x-ray and where your positioning is. We also have targets that are built in that if you said you wanted to put it at 40 and 15, we could show you a halo that does that. It also takes all the parallax and the distortion out, which no C-arm's doing and no other technology in the world is really doing actively comparatively together. So we're able to be the first ones to kind of do it both combined.
That is awesome. So the big number, the $1 million question I have is, what are the surgeons saying? I mean, is this like, wow, or is this a...
So I'll let Travis speak to that.
Okay.
Because, and Travis was humble, and what you don't know about Travis, and maybe we'll, I think this is the best like intro to that, is Travis, how old are you?
I'm 20 years old.
So 20 years old.
No, not yet. We're getting there.
Hold on. In regards to selling it, how do we sell it? We show what?
We show value.
No, we show a video, right? And every video we've shown, a doctor looks down and goes within 30 seconds that goes, how do I get this? And like, where has it been? Right? So it's really cool. Now, sometimes getting that technology in the hospitals become challenging, right? So times have changed, right? So we're, as always, it does cost something. We are making a profit for this, right? So getting that acceptance is one thing. But when surgeons see this, they stay up at night and they're like, man, I don't know. Or they leave the surgery going like, I'm not sure where that leg length is. I think I'm there, right? It's all done on tension, right? Sometimes if you're using a hand table, typically you could have a little bit of feel for tension. But if you're doing a posterior hip, I mean, Samuel, for the people that don't see surgery every day, how would you judge leg length? Right? If there's nothing that told you really what it's at, or there is technology that's sometimes expensive or tedious to get trackers and other things that you have to be more invasive. There's nothing that you just hit an x-ray and it goes, this is the leg length and this is exactly where you want the cup. And oh, here, by the way, like we can show you how to put it in that way. And, it makes it a lot faster and more reproducible for these surgeons. So they're seeing this as technology that helps them sleep better, that helps them have less lawsuits. The number one reason at times for hip lawsuits is due to leg length discrepancy, and we can prevent that now. Like it's really cool to see in 2023 that we have an easy solution for that.
Yeah, it sounds like a no-brainer.
There's cost to it, which is minimal, and it's a fee per case type thing that we're expressing, and we can sign a unit to the hospital. But it's super impressive. And by the way, it's why I became the VP of sales there. I've left this job that I've been done, and everybody's seen me be a rep for 15 years, right? Now I'm no longer a rep, right? So the next step for me was like, I want to carry something that's the best technology in the world. I want to sell something that I'm passionate about, right? I became in this like contextual, like you become in this like wheel, like you're a rat, right? Like you go on doing surgeries and you're doing 1,100 surgeries a year. It wears you out. And not that I'm tired, but I wanted something new to sell that brought value to the surgeon, that I could go in and show a 30-second video and go, what do you think of this? And not even say a word. And they go, that's what I want, right? So there isn't a lot of that in orthopedics. It's been a little stale since robotics came out. And so being that I have in my bag now only one product as opposed to selling a ton, I have to put a different hat on. But I think it's it's allowed me to be a mentor in different ways, and I hope we could talk about that a little bit.
I love it. Okay, and with that being said, let's talk about it. So, everybody listening, one of the reasons why this is such a special episode is because there's a very young man here who got the opportunity to work with Joey, and it's completely changed his life, and to the point that they're able to recreate the opportunity for others. But let me not say anymore. I'm going to pass it to you guys real quick. Talk to us about where you came from, Travis. Why are you here is really the question. Tell the audience real quick, and then we'll keep on talking.
Okay. My name is Travis Harvey. I'm from a little town in Michigan called Lowell, and I ended up moving down here on a whim after my second year of college.
Okay, so second year of college, you moved on a whim, you found Joey, you guys connected, and now you're doing the dang thing. You are a medical sales professional, and you're doing pretty big things. This is kind of unheard of, especially coming from someone from my vantage point, right? We work with tons of people every day that have all walks of life, new graduates, mid-career professionals, and even people at the top that want to transition to something else that impacts patients. But you found this opportunity at 20 years old. So I got to ask, first off, what did you think orthopedics was going to be before you got the opportunity, and what has it actually become? And please speak freely.
Yeah. Me and Joe have talked about this a lot, actually. And I guess to reference, my first day down here was kind of the complete 180 of what I thought it was. The conversations we'd have in the OR room were, we're just talking. We're like family in there. And, at the end of the day, we have a, positive outcome of replacing someone's hip, knee, shoulder,
Right.
Whatever that may be. I thought it was, just a sales job. You can work around your schedule, do whatever you want, go to surgery and pick and choose the surgeries that you go to. There's not a lot of information on, the orthopedic sales role.
Sure.
In total. So it was completely different from what I now see it today.
Okay. So, I want to dig into that just a little bit. So you said you when you were going into it, because listen, you're only 20 years old. There's people that are close to your age listening and people much older, but they're all trying to do the same thing. And just like you, they had all these preconceived notions around what the medical sales they want is, and in this case, what orthopedics is. So tell us a little bit. I mean, you say you thought it was going to be a sales job. What happened? Give us an experience or an event early on in the role that helped you say, wow, whatever I thought is thrown out the window. This is what I'm really doing.
Yeah. So, I mean, I think it was the first day that I got down here. I worked 18 hours my first day.
Wow.
It was crazy. I got up at 4:30 in the morning and I was ready. I was ready to go. I was super excited. Couldn't really sleep. And Joe came and picked me up because I actually didn't have a car coming down here at all.
Sure.
So he ended up coming to pick me up, and we went and pitched a surgeon he picked me up at 6:15, and we took an hour drive down to pitch a surgeon about OrthoGrid, actually.
Wow.
And then after that, we drove an hour and a half back up here, and we did some more training right into the training of the hips. And then that's where I met some of the team. We did that for 6 or 7 hours, and then we went to dinner, and that was a long time too. So I ended up getting home at 10 o'clock, I think it was. It was the longest day I've had in a very long time.
Wow. So when you say team, are you talking about the team you worked with the surgeon? Or okay. So you went with their team.
Yep. So the team that we worked with is 3 guys and then an intern, which is me. So 3 guys on our team for the territory.
Okay, I see.
Yep.
Awesome. So Travis was the 4th. Travis came down and didn't fully say it, but he came down here for a summer internship, and we connected just briefly through LinkedIn. And over a period of time, we decided that he was going to come and actually just do the summer and spend the summer with my team. So when he says team, it's Kanan and Josh, who I've been with on my team for up to 15 years. Josh and I were partners. So it's kind of like a brotherly thing. Like my team, when he talks about it, it's like a family. Yeah. And he didn't see it that way. He saw it more as like a job, and like he said, that you're like a sales guy and you get the car and you go try to sell a doctor, and then you're in the hospital. It's really sexy, right? And I think what he's trying to say is like, man, I thought this was going to be like a really sexy job. And when I found out, like, it's really intense, it's super clinical. We're in surgery every single day.
Yeah.
Right. And, you know, we don't stop. And he's like, going to dinner, like, were we dinner by ourselves or were we with a doctor?
No,
right?
doctor every single time.
So,
every single time.
So like we've talked about before, right, Samuel? And you've probably heard other people say before, I didn't coin this, but, you know, orthopedic sales, it's not a job, it's not a career, it's a lifestyle.
Right.
And so he walked down and got punched in the face day 1 and day 2 and day 3, right? So, you know, one thing on my team is we like you are your weakest link. So we tried to get him up to speed as fast as possible.
Okay.
He got to integrate with a lot of young surgeons that took him under his wing. It was a super cool experience because I think what he thought he was trying to get into and what he actually got out of it is like he made a lot of good relationships, and he had a lot of surgeons take, you know, a lot of time and go like, hey, we're gonna teach you the right way. If Joe's gonna bring you in and you're gonna try and earn your spot on the roster, you know, albeit you probably won't do it over summer, but we're going to do our best job to like shove it down your face.
All right. So let me ask you this then, and this is for Travis now. So Travis, you know, if you were to advise maybe 3 things to our audience right now, and then we're speaking to everybody that wants to be in orthopedics specifically, what are 3 things you would say they need to be, you know, they need to be very, very mindful of going in?
Yeah, I think the 3 things that I could stand to are the importance of going one more, the just continuance of learning. You know, once you think you know everything, and you're not of value to the team at all. You're always learning, whether that's learning a sales technique or being creative in the sales field or clinical, right? How do you change leg lengths, right? How do you do all that stuff? And I don't know, 3 things. I mean, 3 things that I could say right now. The importance of continuance of learning, okay? The importance of always learning, the importance of your team, and your connections. Your network is your net worth. I think those are strong things right there.
Yeah, I think it's a totally different subset than when you're a college kid. Imagine being a kid that's 19 years old, moved down here May 1st on your birthday, right? So you turn 20.
Yep.
And you have this preconceived notion. And then what you see is like, wow, I just went from being at college frat parties to now I'm like in an OR with humans that are cut open, and like there's real high responsibility, right? So if you make a mistake, like we've said before, right? Like it's a 0 mistake industry. So you go from this like, oh, crazy college kid partying, right? Going right into like, oh, I'm going to go in the summer and try to get a job, right? Or an internship of this interest that I like. And you just don't realize how serious it is and how real it is when there's a patient on the table. And, you know, that's someone's mom, dad, sister, or brother. And Travis really responded immediately, like he got it, right? Like that was our concern. I'm like, man, it's really hard to teach someone the importance of what we do, right? Because you just see it as like a medical sales rep, right? You're a salesman. Like the sales comes first, but it's more clinical than it is sales. We're not selling a product. We never once, I mean, I did a long pitch on a product that's cool to sell. We actually have one to sell now, but you know, for the most part, when you're doing your daily business, you're providing a service. And he got to see, wow, Joe doesn't like, even though day 1 we went on a sales call, which was your main thing, was to actually bring you in for ortho.
Yeah.
Which you were excited about. You're like, I want to be the salesman. I'm like, well, back up a step. Like like, I'm glad you want to sell, but like step 1 is like, we need to trust you. Step 1 is you need to know clinical. You know, you can't even walk. You can't even walk into an OR without knowing what you're doing, right? So you can't just have someone just step in. You have to take it seriously. And if you're going to bring a person into the OR, you have to train them, right? And so this is a lot of like what I wanted to ask you, Samuel, is like, in your program, how do you prepare people for that, right? So it's hard to teach that. And so showing that takes both experience, which that's what people want and gravitate towards. That's why it was smart to do an internship. But the problem is that there's not very many internships that I'm aware of that companies usually provide. I mean, we set this up just because I had a wild hair, right? Like it was my idea.
Right.
But I'd love to ask you, like, how do you scale that in your program, right? So like there's a lot of medical sales colleges that are teaching individuals. It's probably a hard thing to teach, right? You could teach about aseptic and sterile technique and stuff like that, but how do you teach all the rest of it, you know?
Right. No, it's real. I mean, for us, our focus with everyone that works with us and all the wonderful people listening, we focus on getting the job. So we're teaching all those intangibles. We're helping people become their authentic selves. And of course, there's involved in that is understanding the specific field that you want to be a part of. And one thing that we love and champion is we don't allow people to just get into any field. Everybody says, I want to get into medical sales. I just want to get in. No, you don't want to get in. You want to find out what makes sense for what you've done, what you understand, your life desires, your life ambitions, and the lifestyle that you want to have. So that's where our focus is. But to your point, Joey, and let's talk specifically about orthopedics. You're right. For those that want to be specifically orthopedics, how amazing would it be to get into a program like ours, know that they have everything to get the job, and then know that they're going to start the job off really well because they have some tutelage like what Travis experienced under you. And that's an opportunity, right? And that's why it's kind of exciting to be able to share the story to everybody that you guys have had, because I'm not going to share it yet, folks, but there's an opportunity for you to kind of simulate some of what Travis got to experience. But before we get there, I want to highlight you, Travis, and I want you to talk about, you are 20 years old. You haven't even finished college, and you already have a track record where you turned down Stryker. I want you to talk about, what do you really understand how to do? Why do you think Stryker valued you so much? You don't even have a degree. How are you showing up that's giving you this kind of leverage?
Yeah, I think it all comes down to what you value and what you see. I didn't say no. I didn't say no to anything. Whenever Joe needed a tray ran at 2 a.m, it was done. Right. I said yes to everything because I was hungry. And I think that's what comes down to it. Like I said, the first day it was 18 hours, right? The next day wasn't any better. It was 19. The next day after that is probably 20. And then the next day after that, the Thursday, I remember it specifically. I got done at 9:59 p.m. And then Joe called me. He's like, you need to run down to Miami. He's like, you want to be a rep? I'll show you how to be a rep. And I remember that so vividly.
Wow.
And I was like, okay, that's it. This is what I got to prove myself. And it was a continuance of that. It was a proof, right? You get into a team and you got to earn their respect. You got to earn your stripes. And I think that's what kept me, above the rest, I guess you could say, and that leverage.
I love that you shared that because, I think I want to say one of the most common questions we get from a new student in our program is, I kind of like ortho, but I don't really want to do trauma. I don't want to work. I want to have, a lifestyle balance, or I don't know. I don't want to work all my nights or all my weekends, but I want to work maybe some nights, some weekends. Talk to us a little bit about what that actually means, because what you just said is, it's not about wanting to work nights or work weekends, or it's about wanting to just be the best provider of the service you're offering your surgeons.
Exactly.
But then you got to wonder, well, is there a time where you're going to have downtime? Are you going to have times where you can say, no, I want to get off earlier today, or I want to take a day off? Talk to us a little bit about what the day-to-day actually has been like for you.
Yeah. So, day one, right? I mean, it was very long. They're very long days. And we would do, regular cases on the weekdays, hips, knees, shoulders, all of that stuff. And then we'd have trauma on the weekends. So hemiarthroplasties, bipolar, as some may know, and then hips and nails and such like that. So typically we would get a call the night before and we would have a surgery time to go and do those things. So managing your time wisely and knowing when those cases and surgeries are going on is definitely your best strength in being able to do that. Yeah.
Okay. I'll direct this to you, Joey. We talk about how hard you work, and Travis just went over the long hours. Give some context to that, though. If somebody wants to get into orthopedics, what is the difference between orthopedics, hips and knees and joints, and trauma and foot and ankle? Give us a little context. What's the difference with those and how you conduct the work?
It's changing. The industry used to be full line, which is what my team has done, where we've done all those joints that you just explained, and then trauma in addition to that. But now it's become divisions typically with a lot of the big. So if you're with a smaller company, maybe you have the opportunity to do some of those things. But when you're with one of the big three, typically they'll break it off in divisions or subsets where shoulder, they keep hip and knee together, and then shoulders by itself, and traumas by itself, and ankles by itself.
Right.
So the job has become more scalable and easy as a day-to-day lifestyle type thing. But it's become harder because your bags become smaller, so you have less things to sell the surgeon. But you can time management a little bit. But with him, I think, and what you alluded to a lot is people don't understand what they're getting into.
Right.
So I think that's where this is really unique, where he thought it was one thing, realized it was totally different than what he thought it was. And as a 20-year-old kid, you can want one thing and then realize, wow, I just signed up for a summer of hell. and it wasn't that we dogged him at all. I mean, you could ask him truly, like a lot of people on LinkedIn, it was crazy. We're dogging me going, you're just having him to do grunt work. And that's albeit some of what he did, but what he alluded to and why it's important for people to understand and what it's about is, no, I actually tried to train someone, bring someone on our team. And in order to do that, they have to be trusted. And in order to be trusted, they have to gain respect. In order to gain respect, they have to put in experience. In order to get experience, they have to give an opportunity, right? So we gave him the opportunity to say no to anything. Mm-hmm. We gave him opportunity to rise to the occasion and say yes. And what he understood was, no matter whether he did it, whether he had to run to Miami and do it, or if I did it, or if Kanan did it, or if Josh did it, he realized someone had to do it. And we all just put in 18 hours of work, right? Or 15 at that point. Mm-hmm. So
he's not going to be the odd man out.
He's someone had to step up, and that's how the world is. And so what people need to understand is like, and for the people who involve your success, I think they should really take a hard look at, you can place someone in any of these divisions, right? You have the resources and you're able to very much fine tune and teach. And orthopedics is just one subset or a platform that you can go into. But if you want to be in orthopedics, you need to take a hard look in the mirror of what your work-life balance is, right? And in the beginning, right, you should very much prepare for many hours for if you're successful, right? And so I ran a poll on LinkedIn very recently where it was 0 to 5, people 0 to 5 years in orthopedics, and 50% of those people voted out of 500 voted, yeah, they're within 0 to 5 years, and then it drops to 19%. And so I wrote an article today, which is very much stating like, there's a huge drop off right at 5 years with medical device sales and orthopedic platform. So the question is, why is that? And I believe the answer is because people get into a position, they want to stick it out a little bit. They realize how to scale it. They have to ruin their life almost in the beginning to do that. And depending on how much they're willing to give or where they are in their stage of their life, it's sometimes hard to say yes to everything. Mm-hmm. And so what he also discovered without anyone saying to it is, I didn't say no. And so what he saw for me is like when a surgeon calls, I never not answered. I never said no. It doesn't matter what I was doing. If I'm in the middle of a baseball field coaching my son and a surgeon calls me and I'm coaching third base, you will see me answer the phone and say, hey, do you need something right away? Is it urgent, or can I call you in 45 minutes, right? So ringing the bell is what he saw from day one. He saw if he doesn't do it, someone else is doing it, right? It's a team. And if you aren't running your program as a team, or you're an individual, or a company's trying to make you scale the business just on your own, run, because you got to have a team in order to be successful, in my opinion.
Gotcha. I love how you guys keep reiterating the fact that it's a lifestyle. So let me ask you this then, Joey, for those that want to be in orthopedics and do have families and want to resemble some kind of a work and life balance, does it get easier? When Travis has been doing this for what, 6 to 9 months now?
7 months. Yeah.
2 years from now, is Travis going to be saying, you know what, now that I've been in this territory for 2 years, it's a little different? or is this the life of the orthopedic sales rep with Joey and OrthoGrid until you decide not to do that anymore?
Yeah, no, I think it does get easier, but as soon as you think it gets easier, it gets just a little bit harder. It's kind of a weird answer, but I think it's super true. As soon as like I thought I knew everything about OrthoGrid, and then I came in and someone showed me a different approach, and there's a whole new avenue of ways to troubleshoot and get different data points, right?
Sure.
So as soon as you think that you know something, you don't. There's always a constant learning cycle, and new and improving technologies, there's always something new. So I think that would be it right there.
Okay. Okay. So I'm gonna ask this then, and both of you can answer. What type of person should not look into being in orthopedics?
Should not look into what? Sorry,
Being
cut
in
out.
Orthopedics.
What type of person?
Should
What do you
not
think?
should not look into being in orthopedics.
I don't think a lazy person should be in orthopedics. I think someone that's not organized shouldn't be in orthopedics. I think someone that looks to get out early or cut a corner shouldn't be in orthopedics. I think someone that's not willing to be participant on a team shouldn't be in orthopedics. Someone that's not looking to be hungry to sell right now in this market where everybody has the same thing shouldn't be in orthopedics. A lot of these things, someone that doesn't have a positive attitude every day, and that's very pessimistic, right? So what you sell is yourself. So if you're a type of person that can be very real, that can be humbled, like he just was stating, like you think you know everything, and all of a sudden something comes up in an OR and a surgeon looks up and says, "What's the answer?" and you don't know it, you feel this big and want to just crawl like in the hole under the door and leave straight to your car. And we've all been there, and you can't be successful in this industry and not have that L, right? And taking an L is a big part of orthopedics, just like anything you want to be successful at. So it's not that it's the most hours in the world it's all what you make of it, right? Like I work a lot of hours. He's got to taste that. That's not to say that everyone puts in those types of hours, right? Maybe I'm a bit of an extremist, right? To some extent.
Sure.
But ultimately, maybe you want to add some things if I left something out there.
Yeah, and I mean, it's kind of all hit on the head right there.
It's passion, right? So you wouldn't do this podcast, right, if you weren't passionate about it. It would show. People would recognize, man, this guy, he asks questions, but he's not really engaging. He doesn't do it every week, like you're passionate about it. So if you're not very proactive in your career, it's too competitive. I believe it's one of the most competitive sales jobs you can have in the world, right? There's a lot of really good companies. They make a lot of good products. And for you to compete against people, you need to sell something different. So for years, I've sold myself, which is what I will always do.
Yeah.
But someone that comes in out the gate and maybe is too enthusiastic or doesn't go, hey, I need to be a real clinical asset in the OR, right? It's about the patient. So yes, we're selling, and in orthopedics, it's a sales job, but you need to be prepared to go almost through like a medical degree. Like if you're doing it right, not that we'll ever be doctors at all, far from it. We don't have all the answers. We do have lack of education, right? So your types of programs that like you've developed have enabled people to have a head start coming in.
Right.
But then there's a resistance and a wall that unless you have a mentor that's continually seeking your best interest and teaching you, whether that be a surgeon, whether that be a manager, whether that be a fellow rep, or a team. And that's why I think that team aspect and what he got to see, he got to scale it and ramp up really quickly.
Yeah.
Because everyone on the team, anytime they had access to him, was teaching him what he needed to know.
Yeah.
And we were all trained the same way. So like we don't all think the same way. We all play different roles. But on a clinical aspect, we're very much all on the same level to where we've taught each other. So, hey, this has happened to me before. If you get into the situations or you see it on your own, you don't want to make the same mistake twice. So he learned that quickly. He made mistakes, but you put a lot of trays together too, right? For the team. And that says a lot, right? Because we're taking pictures and making sure he's perfect and making sure he's perfect. And I never think you once went and never had a picture sent, right? Where we weren't triple or double checking, where everyone on the team's looking at what he touched. So it never hit the OR sterile. And us open up a tray and go, we're missing this, because that's the worst case scenario, right? We are nothing in an OR as a sales rep without having all our instruments and implants.
I think another thing I can like touch on is the importance of the attention to detail. I think that's another thing that people, you know, coming in should know that they need. I remember putting 14 trays together, and Joe didn't tell me this. He was sitting outside the OR or the hospital, and I had mixed one piece up, and
I was just waiting for him to be done.
Yeah, he was. Yeah, I didn't know he was there, and I missed one piece up, and he told me to redo them all of them.
And I wouldn't tell him which piece.
And yeah, he told me. You didn't tell me, so.
Look at Mr. Miyagi at work. Okay.
Mhm.
But it's
That's
better.
weird.
It's better to be caught there than for me to trust and the patient not to have that and the
Right.
doctor need it, because
Absolutely.
what people that know in orthopedics is depending on what that piece is, and we run just in time with most of it, we only have one. I mean, so the 14 trays is many different sets.
Never did
We
that.
needed, but the next day we needed all those sets, right?
Mhm.
So, and so had I not been there as that mentor to check those trays, he would have found out a really hard lesson.
Sure.
And we've all found that lesson out. And
Sure.
luckily you haven't found that out, because we didn't ever let you get to that situation where you messed up. So it's hard, right? And last time I was on your show, I think I alluded to the fact that, like, when you're putting those trays together, typically it's after a really long day, right? Where you're just like, I want to go home. But that's where you have to lock it in the most, because that's where the mistakes happen, and that's where you hurt the patient or you lose the business. Because if you make one mistake, a doctor could look at you and be like, you're done.
Yeah.
Right.
And you will never get that business back. And so, unlike most sales positions, like, you wear different types of anxiety levels where you're like, man, I'm doing it for the patient. I'm doing it for the patient. That's where your head has to be.
I love it.
Because if you're doing it for yourself, you will make that mistake regularly, in my opinion, and you'll miss things.
Wow. Travis, let me ask you this. Have you done any cases all on your own yet?
Yeah. Yep.
So
I run the eastern part of the United States.
He's a big deal now.
okay, now, so
Yeah,
now,
I run the
now,
Eastern
He
part of
flies
the
all
in
over
bed
the
now.
country now.
Okay. So let me ask you this. You know, you're a young looking guy. When you walk in, you know, is it, talk to us, man? Are they let's get to work? Are they like, wait a minute, who are you?
Yeah, no, that's a great question, Samuel, and I definitely have an answer to that. They don't say anything about it. I come in there and I'm clinically equipped, right? So I don't think it takes time for information and knowledge. I think it just takes the knowledge and information and, you know, doing it right then and there. You're going to cut this part out because I want to rephrase it. It doesn't take time to know things. Okay. It takes information. And when you have that information, you're able to do so much with that. And knowledge and applied knowledge is power, right? So as soon as they know that you're clinically equipped mentally, then you're set. Obviously, if you have an issue go wrong and you need to troubleshoot that, you need to know how to do it. And that just comes down to knowledge and expertise and experience, right? And having that mentor or that person, your boss or whatever it may be, to come and, you know, and kind of have that safety net beforehand.
Okay. I want to hear from you, Travis, and I want you to think of a specific case and speak as freely as you can.
Mhm.
I want to hear, you know, I want to hear what you were working on, what you were doing, the surgeon, the type of surgeon you were working with on the case where you said, holy crap, this is what I do for a living.
Yeah, I think, oh man, I know
First
exactly.
case.
Yeah, I'm gonna say
The first case.
Dr. Kranzow. Yeah, Dr. Kranzow. He allowed me in his room. He didn't know who I was. Joe brought me in, and we're at a surgery center. And I was super excited. And this was the third day ever coming down here. And I didn't think anything much of it, right? I'm in the OR room. Joe's bouncing around, being Joe, and I'm just sitting in the corner, right? Because there's not a lot of room in this room.
Sure.
And I remember he was performing the osteotomy, which is cutting the femoral neck for all the viewers that aren't in orthopedics. And I got this like feeling, like my stomach dropped. And Joe comes over to me and says, "You're all right, man." I'm like, I'm good. I'm okay. And then my hearing started to go away. and my sight was kind of getting blurred.
Wow.
And he's like, "You don't look so good." I'm like, "Joe, I'm not okay." And again, third day, we don't really know each other that well. He's like, "This guy, dude, come on." And I end up getting out of there with I also have a lead vest on too. And these are like 20, 30 pounds. And I was about to go down. I was so close, but I got out of there and everything was fine. But yeah, that's when I was like, "Oh man, I'm in orthopedics and there's a lot going on there."
Man,
He just took a
Travis,
saw
that was
blade
an
to that
awesome
guy's
story.
hip. Are you kidding me? And then he pulled it out.
And then he pulled it out.
Are you kidding me?
I'm like, "Oh my god!"
I'll never forget. Travis looks at me and I'm like, "You're good." "Yeah, no, I'm good. I'm good." And I look back up and he's like, "Hey, I can't hear anything." And I was like, "What?"
Yeah.
He's like, "Yeah, my ears are ringing. I can't hear anything." I'm like, "Stop locking your legs." And he's like, I don't feel so good." I'm like, "You need to get out."
Wow.
And that was the only time that ever happened.
Yeah.
But I'll never
That's-
and I've
you know,
never
that-
seen
that's-
anyone pass out in OR. I know people
Yeah.
have.
Right,
And in my
right.
experience, I've never seen it. But he was very close.
Yep.
Travis is how big are you? I don't know if I'd have been able to pick you up.
No. Yeah, 195, something like that.
Wow. That it doesn't get any more real than that. That's
No, it
thank
doesn't.
you for sharing that
It
with
doesn't.
us. That is awesome.
And Dr. Cransall likes to make jokes. Another time too, I remember I was in orthopedics. I was with Josh. I was with the senior, more of a senior rep than you. But he's like, you want to do the Hanatep? You want to drop the leg and adduct it? And I'm like, "Sure, of course, I'd love to do that. I want to go back and tell all my friends,
Right,
I'm
right.
this internship and I get to do this." And Dr. Cransall, as I was dropping the legs, he's like, "Stop, stop, stop, stop." And he was like, "I'm just playing with you." And my heart sank. I was like, "Oh my gosh, what happened?"
Just toying with your
Josh, what did
emotions.
you do? And Josh was like, "I knew he was gonna do that to me." And I'm like,
Wow.
and that's the thing though, is again, coming into this, I didn't think that stuff happened, right?
Right.
And it does, like, it's a family, right? And everything, obviously nothing happened, but that's the type of relationship you have in the OR, right? We have music going, it's more playful than everyone assumes. And that's the type of, atmosphere,
Healthy environment.
yeah, atmosphere, healthy environment that I think someone needs to grow.
Oh man, you are a walking infomercial for orthopedics, Travis. This sounds so attractive. I love, and you're beaming just talking about it. So you're living your best life right now, guys. This is awesome. And let's go ahead and let the cat out of the bag. So everyone, we in our program with Evolve to Success, we're going to be partnering with these two gentlemen here for orthopedics only, specific orthopedics. So for all of you out there that you want to be in orthopedics, or you think you really want to be in orthopedics, you already know I'm going to tell you to go to evolvesuccess.com and fill out the application, but I'm still going to say that again. And if you want orthopedics, when you talk to our account executives, let them know you are interested specifically in orthopedics. And we have a new program where we're working with Joey and Travis, and we're going to get you where you want to go in the orthopedic space. And what makes this a little unique is orthopedics, there's a lot of course, there's the big companies, but there's a lot of distributors that provide amazing opportunities, as you're hearing right now, like OrthoGrid and Travis, that these guys and us are connected to. And we are going to be utilizing that network to get you where you want to be, for those of you that want to be in orthopedics. So if you're listening to this episode and you're thinking to yourself, "Oh my gosh, this is it," evolvesuccess.com, and make sure that the application, and you have to talk to one of our account executives, and you'll be working with these guys right here. Guys, we're going to wrap this up. Before we do, though, we're going to get into a lightning round. Are you ready?
Yeah.
All right. So I was thinking we'll do it where I'll ask the question and then either one of you answer and then the other person answer, and then I'll ask the next question. So the first question is, what's the best book you've read in the last 6 months?
Ooh, I'm going to say 48 Laws of Power.
Which one?
48 Laws of Power.
48 Laws. I read that one. That's a good one. Okay. All right. Joey?
I don't read.
His head is
Truthfully,
in a medical journal.
What's that?
I said your head's always in a medical journal.
So what book do I like? Actually, one of my best friends from high school just finished writing a book, and it just published last week, and I just finished reading it. It's called Gwenny's Gift. It's about her daughter having type 1 diabetes, and it's amazing. It's not all just about diabetes. It's literally a story about, I don't want to ruin it for you, but about a girl that has diabetes, and it goes on these challenges. And
Say no more. I'm sold. We're checking
you
this
should
out.
totally, it's on
We're checking this out.
Amazon. It's by
Yeah.
Gabriella Bianchini. It's
Okay.
called Gwenny's Gift. It's a must buy. It's awesome,
Hey,
awesome.
everyone, that link will be in the show notes to get
Awesome,
that
cool.
book. So you know you will be able to get that book, and I can't wait to read it, and I can't wait to read it as well.
It's awesome.
All right, awesome. That's definitely going to be read. Okay, next question. What's the best TV show or movie you've seen in the last 6 months?
You know what? That's kind of a trick question because I don't think me and Joe watch TV. I don't think we got time for that. I don't, at least.
19 hours. I don't see how you could.
What movie have I seen? Man, you know what I saw with my kids last night was Mario Brothers, which was pretty cool. It's on Netflix. It's redone, and it has like Donkey Kong, has everybody like. It's crazy to watch my kids like look at these characters. And I'm like, you don't know what these people are? Like, no, I totally do. And I've already seen this movie, Daddy, and this is what happens next, right? So he ruined all the best parts, but that was a pretty cool flick.
That's awesome, man. That's awesome. All right, what is the best meal, and by this I mean restaurant and the item, that you've had in the last 6 months?
It was up in Cape Cod, actually, about a week ago, actually. It was a half lobster with filet mignon. It was really good. Delicious. It was Cape really Cod. Good.
Okay, give us more specifics here. What's the name of the restaurant?
It was Frederick's House or something like that. I don't remember. Something House.
Okay, something House in Cape Cod. All right.
Yes. Yeah.
How about you, Joey?
Last week, my favorite restaurant's Bucan. It's in Palm Beach. They have a bananas Foster like deconstructed dessert that's amazing. They have everything's amazing there, but they have a warm carrot salad. They have kind of everything. It's kind of farm to table type deal. Okay. This agnolotti pasta that they have, it's literally like a corn pasta, and it like explodes. It's awesome. Yeah.
Okay, that will be visited. And then last question, last but not least, what's the best experience you've had in the last 6 months?
I got to see Dr. Urezamides in the OR do, I'm not going to say how many hips, but he's one of the most fantastic surgeons I've ever seen. So he's out of Louisville, Kentucky. He does hips only. I think he does upwards of 1,000 hips a year. And he and his team of reps and nurses and staff run. You were there as well. It was my first day on the job at OrthoGrid. I've seen almost, I'd say probably north of 13,500 surgeries probably in my life.
Sure.
And the 11 I watched him do in one morning was unbelievable. The things that they do they're perfect. It was like watching a symphony. That the entire team from the minute you walked in the door, the nurse to the scrub tech to the anesthesia, it was like a symphony. And I kept waiting for like the trip to fall to go like, here's where you guys messed up. Like, but they didn't. Like, they were flawless from 7 a.m. to 2 p.m. He's amazing. So anyone that's ever has an opportunity, you can go see him. I think he teaches for Zimmer. He's amazing.
Wow. Well, if I ever need a hip replacement, I hope he's still practicing. That's fantastic. And how about you, Travis?
Yeah, I think just this opportunity to see, more than just orthopedics, but the world, right? And the eastern part of the United States, just being able to get this opportunity is it's a gift in itself. And you learn a lot from different people and the people that you meet, and it builds character, right? And I think, since I'm so young, I still have a lot of learning left to go. So, the more people and more surgeons and more workflows I get to see, the more equipped and better I'll be. It's almost like you walk into a room and you see perfect for them, right? And I'm so used to this little bubble in West Palm where it's perfect for our surgeons. Well, now I get to see what's perfect for everyone else. And to piggyback off of what Joe was saying, it was like a work of art. Yeah. Right. And no one, frankly, I've ever seen do better hips than that. So
I've seen a lot of good hips, and there's guys around the country. Not that there's a lot of really talented surgeons. But yeah, you're right. Sometimes you see just someone that's like special that you're like, man, that's different than what I've seen, and you're doing things a little bit different, just slightly, But it's a real testament. He's had the same rap, Stu, for a very long time, Stu Moser, and then Seth was there too, and they're super competent. And to watch it from the outside looking in and going like, all right, I'm seeing this from a different perspective. Normally, I'm the rep running the table for the hand table, making sure all the instruments and the implants are good, watching their flow, and to do it so seamlessly, it's sometimes it humbled me, right? Where I'm like, man, I thought we were perfect, but I wasn't perfect. I was good, but I wasn't perfect. And not that they're perfect. I see things, right? There's flaws everywhere. But when you look at it through a different lens and you're like, all right, I'm here as a different resource in the OR now, before as a clinical specialist on technology, as opposed to on a hardware implant situation, you get to sit back and watch everybody else's flow. So you're not involved with the flow of the OR like you were before. You're there to help become more efficient and help their processes. And that's why we're in a room like that, because they're trying to look for efficiencies, right? And so the best teams in the world are obviously trying to use the best technology and to really become the most efficient, reproducible robot, right? So in my opinion, like the best robot in the room is the doctor, not a machine.
Right. No, what I love about listening to both of you, and I think the dynamic that you have, this mentor-mentee relationship, Joey, I love having you on the show because you have a serious amount of experience. Just the fact that you've seen so many surgeries that you literally
a lot of time. I don't know if I can get back, but
you literally look at it as an art form. I mean, I love your description.
Love it, man.
I mean, that's
my love. It's my passion.
Only someone that has been in it long enough and has enough experience can make a comment like that it was like watching a symphony. And I love the fact that Travis gets to learn from you with a whole new, fresh set of eyes. So having you on this show together, talking about the same thing from different perspectives, it really shows the respect you have for the craft of what it means to be a medical device sales rep in orthopedics. So thank you both for being on the show today. I can't wait till all the students that hear about the opportunity that we're all presenting to them to work with you guys. It's going to be awesome. And this is amazing. And again, thank you guys for being on the show.
I have one more thing to add before you cut out.
Please.
And I want to thank Travis for putting his faith in me and trusting that this opportunity, because it was a real big leap of faith on your end, and trusting that the program that I was trying to sell to him was like, hey man, we're going to put you through. You're the only one that's done this, but we want to try something, and we think we can add a lot of value to someone with nothing really in return other than getting, you did help us become more efficient. But it's a testament to maybe others. And like you said, Samuel, like, for people looking for new opportunities like that, sometimes taking a leap of faith, it pays off. And sometimes even if someone doubts you, or you have a lot of people in your life that was like, you're doing the wrong thing, you need to come home, you need to not do what you're doing. And if you listen to those doubters, you wouldn't be sitting here today on your podcast, with the role you have today.
Yeah.
Right. And so sometimes, believing what's in your heart and going, I'm going to trust that, that someone is going to put the energy into you is good. And there are programs out there like that we hope are developing, in the very near future that are going to look a lot like that. And that if people adhere and they buy into those programs, their life can change. I mean, is your life changed now?
Yeah, it's completely flipped around to, paying for college and, and I'm all about college. I love the college life, and not necessarily all the extracurriculars that you do, but studying, learning, all the things that you're going to need at one point or another. But I think if you have a sole passion and drive for, and knowing what you want to do, I strongly affirm that you go and take that leap of faith, because I was scared. I didn't know where I was going to live. I didn't know what I was going to drive. I didn't know what I was going to I didn't know what I was going to eat the next morning.
We didn't cover this, but I actually bought Travis a car when he moved down, which somehow we didn't even come up, but he was supposed to move here and drive down with a car, and he showed up on an airplane. I'm like, where's your car? And he's like, my car has 350,000 miles on it. I don't think it would make it here and back. And so literally we were like, all right, well then we'll rent you a car.
Mhm.
And you go to the dealership and guess what? You can't rent a 20-year-old car.
Right.
I knew that,
No.
but you can't. We found that out the hard way.
Mhm.
So I
Yeah.
literally bought him a
Wow.
vehicle, which he still has
I do.
today.
The
And he
dedication.
pays for it, but
I
we
do.
funded we
Right,
funded
right,
the
right.
buying of a car for him.
Right,
I
right.
mean, his life has changed. It's awesome. And I'm
You
happy
know
for
what?
you.
And let me add something too. You know, everybody listening, you already know that our program, you're gonna get the job. What's a little bit different about this offering with Joey and Travis is, of course, with them you're gonna get the job, and you're gonna have a deeper network within orthopedics, but you're gonna get that training so that you start off incredibly strong, and that's the nuance here. It's almost like you're getting remote tutelage from Joey and Travis. And what there's no, in my opinion, there's no better way to get training from the expert and the fresh face that are both doing the same kind of work. You literally capture every perspective that you could possibly have. So again, this is fantastic. Thank you guys for being on the show. You guys are doing amazing things. We're going to help a lot of people. And you, the audience, make sure you tune in next week for another episode of the Medical Sales Podcast.
Thanks, man.
Thank you.
And that was Joey and Travis. Well, I'm going to get right to it. You heard it here, folks. This is a new program that we have. In this program, you're not only going to be giving yourself one of the best chances to get into an ortho device sales role, but you're also going to be given the best chances to perform powerfully your first year in an ortho device sales role. In this program, we're not just going to be teaching you the science and the procedures and the OR etiquette. We're also going to be teaching you not only how to forge relationships with the surgeons, but you will literally be forging actual relationships with surgeons. There is no, when we put this together, we pretty much said to ourselves, this has to be the most in-depth and profound program that anyone can access. That really gives everyone backdoor access to the medical sales world. Things that you just can't find out unless you're working for a company and you're deep in the throes of the job. And that's what's going to set everyone apart, right? Because now you're going into your interviews, forget about just being confident. You're going to your interviews because you literally know exactly what needs to happen. So it's almost like you're showing up as someone that has experience. And then to add to that, you're leveraging the relationships you've developed even before getting the job. That's huge. And the network that you have when you combine the EYS network, Joey Testa's network, and Travis's network, and the inroads with the healthcare providers that are already established, it's a very powerful program with an amazing opportunity. I can't stress to Travis enough that, he's literally walked into a dream because he got into this when he was 19. He's 20 now. He's been doing this for, I think he's coming up on a year, and he's a rock star, and he's confident, and he's ready, and he's hungry, and he just wants to go do that much more and be that much better. And it's because he got the tutelage of someone that cares just as much as he does, and he's been in the industry over 15 years. So when you combine these two guys, you get yourself a very interesting set of perspectives. This is what the expert believes, and this is what the newbie has implemented that he's learned from the expert, and maybe in some cases added his own twist to make it even that much more effective for him. And this is the program that you'd be a part of. And then when you add that to what we're already doing and what's already happening with the Medical Sales Career Builder, you get yourself a rockstar program where you're going to show up like no one else is. So again, for all of you out there that are listening, even if you said to yourself, what's going on with ortho? I don't know if I want that, but I'm interested. Then you better let us know. We're going to be offering this program as of right now. So if you're listening to this episode, guess what? The program is available for you. Fill out the application, schedule some time. When you get in front of one of our account executives and they interview you for eligibility into our program, share that you want the EYS ortho program. And then we, of course, will walk you through the criteria, Just so everyone knows, this is not an open program. This is a select program, and there's going to be multiple interviews. So you're going to be screened by our intake coordinators, then you're going to be interviewed by our account executives, and then if you pass both of those interviews, you get one more interview with either Joey, Travis, or both of them. And only then can you be approved to get in or not get in this program. And of course, if you don't get in, it doesn't mean that you can never do it. It just means for reasons that we'll cite. We're going to let everyone know this is not like an interview where you have no idea what you did wrong or did right. We are going to tell you exactly why we will not allow you to get in at this moment, and even give you feedback on what you can do so you can make yourself eligible for this program. Again, this is such an exciting thing. I'm so happy to bring it to the masses. And as always, thank you for listening to the Medical Sales Podcast. If you're looking for a position in ortho sales, med device, then you better get to the website of harveysuccess.com and fill out that application. And of course, if you're just looking to be in medical sales, then you already know you can go to harveysuccess.com, fill out the application, and we can get you exactly where you want to go. As always, we do our best to bring you guests that are doing things differently in the medical sales space. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.